Natalie Lopez here, going over our stretch of the week. So this time we're going over another nerve floss for our arm, which is called our median nerve. So more commonly, you might hear people talking about carpal tunnel syndrome because this nerve comes from our neck and goes all the way down into our wrist. There's a lot of areas there can be entrapment. So it can start from the neck, from your chest, even just like in through your forearm. But the one we hear about the most is carpal tunnel because that's where it does get the most entrapped. So it can affect your middle finger, your index, and your thumb, and you can get tingling even just throughout the entire arm. So this stretch I'm going to show, well, I shouldn't say it's a stretch, it's like flossing because we're trying to get movement through the muscle and the nerve, but not trying to pull at either end because nerves don't really love being stretched. So we're trying to help glide that nerve through the muscles and give you a little more space. So for this one, I'm going to show you two different versions. So one, you're going to be just bending the wrist, opening your arm out, getting a stretch from your chest, coming back, bending the wrist this way. So coming out through here, my neck is kind of in neutral. I'm not really forward or side. If I go out to the side like this, it's going to be a little bit too much of a stretch, especially if you're already experiencing some tingling. And then you're going to be bringing it back and coming back through here. So this stuff, I recommend around 6 to 8 repetitions if you're ready. This is more of like a maintenance. I want to stretch and make sure that my nerves are gliding well, kind of like flossing your teeth. Then you can kind of consistently do it on a regular basis, once a day. But if you are actively having some tingling or numbness in through the area, you should be doing this a few times a day. If it's acutely flared up, I recommend people doing it every couple hours to keep that nerve gliding through our muscles and trying to reduce that entrapment in the area, and making sure this feels okay. So if you're pretty good with this, you can advance it. So the other one would be kind of involving your neck. So you bring your head here, opening up to the side, coming back, and then leaning your neck to the other side. That way you get a nice stretch and dropping your shoulder down, coming back, opening up through the hand, coming back through here. So this one can be a little bit intense if you're having quite a lot of numbness and tingling through the area. You want to ease into this. And then don't do these both at the same time because that's really stretching out the nerve. Unless you feel pretty comfortable doing that and you have no numbness or tingling, I'd recommend sticking with this and just dividing it where you're stretching the arm while the neck is kind of more not in a full stretch position for that nerve, and then stretching the neck while the arm is bent. All right, so that's your median nerve floss. Give it a shot.